Welcome back. So joining us now to tell us more about Pistis Foundation and Ubomi Outreach is a thought leader, conference speaker, and leadership coach with over 2 decades of exceptional track record and cross-functional experience in leadership, business strategy and execution, human resource management, and social entrepreneurship. He is the Executive Director of Pistis Foundation, a non-profit social enterprise vehicle with key focus in education, health, and shelter initiatives. Welcome with us, Leonard Thomas.
Good morning.
Welcome, sir. Welcome to the show.
Thank you for having me.
So tell us what inspired the creation of the Pistis Foundation and what gap did you intend to, bridge with it?
Once again, good morning, everyone, and thank you for having me. Right, Pistis Foundation was founded primarily because of the gap in our society, especially in the areas of health and shelter, as well as education. As we know, the growing need for education in the country is something that everyone is aware of, right? Statistics tell us, for example, UNICEF came up with the recent data on out-of-school children, right? Sometime last year, saying that about 18 to 19 million out-of-school children in Nigeria. Based on that data, you can also tell from what they said that is the highest number of out-of-school children in the world. When you talk about health, for example, one data that I can speak to is that, WHO, which is the #1, global body for health in the world, says that the standard protocol when it comes to patient-doctor ratio is 1 to 600. But from what we have currently in Nigeria, we have about 1 to 9,000 or 10,000, patient doctor-to-patient ratio. That is staggering. And, it's a call to action to every well-meaning institution as well as individual who wants to give back to the society. And that is what inspired the setup of Pistis Foundation.
Okay, so for every business, you must have a vision and a mission. So can you tell us what your vision is, and also how have you been able to achieve your goals, your vision or your mission statement?
Yeah, so when we started, our goal was primarily to address the gaps, but we saw the need to have a clear vision. We started with a 5-year plan. Our vision is very simple and clear: to be a model provider of empowerment of opportunities for the economically challenged. So we noticed that it is not enough to focus on the less privileged, right? So we're deliberate about, the economically challenged, because a lot of enlightened people who are, challenged economically. Just 2 days ago, I was just talking to someone who, had become, an artisan, and she was telling me that she was a graduate, right? But she was doing it in such a manner that, was noble, if you allow me to put it that way. So when there are issues with quality in anything that they're doing, right, they are not able to do it at optimum level because they don't have the need. Sorry, they are not empowered to do it, right, because of the economic situation in the country. So that is pretty much a summary of what our vision is.
Okay, I'd like to ask, as regards your foundation, the involvement since it began. Could you highlight on some basic projects or milestones that you have reached that has reflected your journey so far?
Yes, in terms of milestones, right, like this week, where we're in right now, we're having our flagship initiative. It's something we do annually, right, known as the Ubomi Medical and Surgical Outreach. It's our 5th edition. Coincidentally, this month we will be turning 6 as an organization. So it's happy anniversary to Pistis Foundation. And thank you very much. And so that Ubomi Outreach is primarily focused on, addressing the health needs in the country, right? It's something that, enables us to partner with well-meaning individuals as well as institutions where we garner, doctors from across the country as well as medical practitioners from around the world in one place. and we're able to pull together close to 4,000 to 5,000 people in 1 week.
Wow.
Every year, right? And the whole idea, you know, in a simple way of putting it, is to put like a hospital in a community, allow people to come in to access quality health care, right? So that's one of the major milestones in terms of what we do at Pistis Foundation. Another major milestone is education. So we've seen that a nation can never be better than its citizens, right? So we realized the need to set up structures to address the gaps in education. You know, when we started in that space, we set up a scholarship program. The goal that we had in the first 5 years was to, you know, sponsor about 250 children in education in terms of scholarships. Why 250? Because a lot of the times people are looking at the numbers, but we saw that we needed to focus on quality education as a foundation. So we have currently over 100 kids in 5 states in the country where we sponsor their educational needs. But we didn't stop there. We saw that we want to be able to address the issues of talent because, you know, it's important to be balanced when it comes to, you know, educating citizens. So issues that like sports, innovation, STEM, technology. We've set up a program known as Wings Academy that's run for a while. You know, just sometime earlier in the year, we had, you know, children who we pulled out from the streets. We trained them for about 7 weeks. You know, kids who are on the streets, train them in football and innovation, right? So every Saturday we had trained coaches who came in, trained them, you know, because, you know, when you leave these kids to stay on the streets, they become a menace to society. And the need for us to address these gaps is very critical. Every person out there, you know, if you live in Lagos, for example, you see that at almost every point or junction, you're seeing street kids. And not everybody is, you know, doing anything about it, right? We see also that if we don't do something about it, we can have another Boko Haram. We can have another, kidnappers and all of that.
Okay,
so
well
this
done,
is a major issue. Yes,
yeah, Mr.
awareness.
Leonard, you've said like so much. Like, in fact, some of my questions I was going to ask sort of answered it. One of it was supposed to be about collaboration and partnerships, but I guess from your answer, you do a lot of partnerships with doctors and teachers and coaches as well. But what are your challenges in, you know, all these plans that you have and all these projects and all these people you're helping? What are the challenges that you face in doing your work?
So I'll speak to 2 amongst quite a number, right? The first always is funding. Why funding? Because the needs are constantly growing. You know, and you know, when you look at, you know, the standard protocol when it comes to economics, right? You have demand and supply, right? So the demand, for example, for healthcare is much more than the supply, right? It's a major issue we're dealing with. So how did we address the issue of funding? One structure that we put in place was an endowment fund. So we do a bit of research at Pistis Foundation. We had to research global foundations as well as local foundations before we started. And we looked at a few models. One of them was a Ford Foundation model. You know, they're over 100 years old. They've pretty much done well. They have office here in Nigeria. And, you know, the truth is that model works. So we set up an endowment fund. Beyond that, we also have, you know, partners that we're accountable to. They see that we're credible as an organization. We're constantly doing a lot of reporting.
Is that local or international partners?
Both, actually. So we're constantly giving them reports, whether it's our quarterly newsletters, annual impact report. Like when we are through with Ubomi, we have what you call the Ubomi Impact Report that goes out to all our partners. It's downloadable on our website. That speaks to the data, you know, and how the outreach fared, whether it's the breadth and depth of impact that we achieved at the project, you know, and that helps us to be able to address the issue of sustainability as well as partnerships. In terms of the other points that I mentioned, you know, because I was going to speak to 2, I talked about funding. Yes. The other one is collaboration, right? Everyone who wants to scale any initiative cannot do it alone. right? We have what you call the PTS model at Pistis Foundation. PTS simply means pilot, test, and scale, right? So we pretty much don't just venture into projects. We see that if you want to venture into projects, you can pilot, right? It helps you to reduce your errors. So we test, we assess, then before we scale. At the foundation, we're at scale level right now, right? We're trying to scale our initiatives. We want to set up a hospital, want to build a school, we want to be able to set up a bigger homeless shelter because we have a homeless shelter for, or a shelter for homeless children, right? But in terms of, partnerships, the truth is we see that a lot of the times we see people or institutions who have the means, but they don't share our values, right? And, the basis for any well-meaning partnerships is always your values. You have to share the same values. You have to share the same ideologies for you to be able to collaborate effectively. It's a major challenge because in Nigeria, there's a huge trust deficit. And, it's something that we're working
So you talked
towards,
about Ubomi.
Yes.
What's the inspiration behind Ubomi? And how has it helped so far in everything Pistis is doing?
Well, and I'll speak with, let me speak to the first time we did Ubomi. At Pistis Foundation, health wasn't even our main focus. But when we did the first Ubomi, there's something called planned strategy and emerging strategy. So you have planned that, you're going to do something. So what we started with was education. We wanted to address the issues long-term in the country, right? And we realized that the demand for healthcare was staggering. And we saw that we needed to refocus and, allowed health to be our main focus. Because it's only a society that is healthy that can be productive, right? You cannot have a productive society if the people are not healthy, right? So in terms of Ubomi, right, we've seen that because that need is growing and the people, particularly at the bottom of the pyramid, are not getting quality healthcare. They're not able to access quality healthcare. It affects the economy in the long term, right? So Ubomi is something, that we started in 2019, and in simple terms, it means life, right? It means life. It's a South African language called Xhosa. I know that question was going to come up.
You didn't see anything.
We're just thinking about South
No, we're taking it personal.
I know. But I know where Nigerians are with South Africans right now. So the reality is that, we're in a good place then. And, that was in 2019. And the truth is, we have a big picture when it comes to resolving our issues. It's one continent.
Yeah, absolutely. Like I always say,
take visa to
one black.
Well, anyway,
but one continent.
I'd like to look at volunteering support, which is usually a deficit with a lot of foundations, people coming in and supporting. But you have also mentioned, like Ubomi has got over 300 volunteers that are involved this year. How important is volunteering service to support in making Ubomi a success, and what roles particularly do these volunteers play?
Yes, the truth is volunteers are the hallmark of the impact that we dish out, right? At Pistis Foundation, there is, because we're a non-profit enterprise, the truth is you have to have models that work. One model that we have realized that we constantly work with is what you call low cost, high volume, high impact. And what does that mean is that how do you achieve high volume and high impact with low cost, right? So we have a volunteer model that we work with. Like this year, we have over 300 volunteers at our Ubomi Outreach right now, right? We have a little over 100 doctors from around the country. We have about 7 doctors from America who are on ground. And, we've seen that, just their presence, as well as non-medical volunteers, their presence helps to form, the impact that we give out. They are very critical to what we are doing because we cannot pay for their services. That's the reality, to achieve the impact that we desire to achieve. One doctor, for example, who is a specialist, let me give you an example. Just yesterday, I was in the ENT section of Ubomi. ENT simply means ear, nose and throat, right? And, the doctor had seen a particular man who had had a fungal infection in his ear for 10 years, right? And the doctor was, he showed us a device, because they used the latest technological tools. And we saw the fungus, right? And saw after he had removed the fungus, and we saw his eardrum. And the doctor was saying that if, he was asking him, how was he treating it? And he said he kept going to chemists and pharmacists because his ear kept aching and he wasn't hearing anymore.
For 10 years.
For 10 years.
Whoa.
That is heartbreaking, right? And, you can also see the level of ignorance. He couldn't also access healthcare because he didn't have the funds.
Exactly, that was also
right? So that hit me hard, and that gave me some sense of fulfillment that what we're doing is meaningful, right? So that is very, very, I hope I responded to your question.
Yes, but
we'll take a short break.
Okay.
When we come back, he'll respond more to your questions, Dami. We'll be right back. Welcome back. We're still having a conversation with Mr. Leonard here on Pistis and Ubomi.
So because he spoke about volunteering, and I know that we always know that money is the jet that fuels the company. So how have you been able to either pay them, or how have you facilitated some of these, your international doctors that have come to Nigeria? What exactly is your funding capacity? How does it look like?
Well, frankly, we don't pay our volunteers.
Nothing at all?
Nothing.
Oh, okay.
Right?
That's why
and that's why I spoke about value.
Nigeria, I stunned.
So, however, we cater to their accommodation.
Okay.
Right? We also cater to their feeding.
Okay.
We cater to their transport when they're coming from different parts of the country. Although our international doctors who have come in, they cater to their transport completely, their flight tickets on their own, So they literally giving back to the country, right? Or giving to the country because, not all of them are from Nigeria, But, earlier on you asked me about, our volunteer structure, and, I was trying to speak to the issues of, how we, when you look at a consultant's time, a specialist, for example, because when you look at the medical practice, you have general practitioners and you have specialists. You literally are not able to quantify the amount of time, the amount of commitment that they give when, we set up Ubomi or when we drive Ubomi, right? When we've done a top-of-mind estimate of how much, an Ubomi outreach will cost if we're, paying each doctor, right, or surgeon, because we have about 27 surgeons on this project, right? If we're paying the nurses,
quite a number.
right? Yes, on the other, medical practitioners, it runs into billions, right? We also do free surgeries, right? From dental surgeries to dental care or procedures. We do eye surgeries, removing cataracts, pterygium. We also give out free eyeglasses during the 1-week project. We do fibroid surgeries. In fact, from data that we have gathered over the years, we have discovered that the highest demand usually under surgery is fibroid cases.
Yes.
And
Bless you people, Lord. This is huge.
So where are all these places? Surgeries happening and all
right
these
now,
projects?
the place where we're having Ubomi is in Pistis Annex in Lekki of Lagos, Nigeria. Precisely Remiolowo Street in Lekki, right? From Monday we started, and it will continue up till Friday this week. We've had people who started coming in from Saturday from across the country.
Just to wait.
Yes,
Yeah, I've experienced something like this before. One of my friends volunteered, I think from a church. She volunteered to be part of a program like that. She did it at a teaching hospital close to the house at Aja, mother and child.
In fact, that was our project. So we at that particular year, that was 2 years ago, we partnered with the Lagos State government, precisely Mother and Child Care Hospital. We had the First Lady of Lagos State, Dr. Ibijoke, also come in, and she toured the entire facility.
Okay,
So
let's
Yes.
talk about your 2024 beneficiaries. I
Yes.
know that I think your data is giving you about 5,000 people who would likely benefit from.
Yes, that's what
Ubomi.
we're planning.
Yes. So how do you get these 5,000 people, and how do you ensure that the outreach really covers their healthcare needs?
Through partners like you.
Okay.
Right,
That's why you're here.
Yes.
Okay.
All right. Thank you very much again. So last week we were on radio, one of our media partners, and we also try as much as we can to do some level of publicity. But we know that those who really need this, a lot of them are not, on the social media, right? So as much as we try to use the social media platforms, we clearly state that this outreach is strictly for the less privileged and the economically challenged, right? So we try as much as we can to also do what you call hand flyers. And we go into the interlands, right? Whether it is Mushin, whether it is, but we are amazed at how people from Ibadan, Kwara, Delta,
about you and
hear
come.
about it and show up.
Somebody will tell somebody.
Do you plan to go to
Other states.
all around?
Oh
Yeah,
yes.
other states.
Oh yes. If we are
Especially the
able,
north.
yes. If we get support from well-meaning institutions, it's something that we can easily do. Our partners have done this. Our medical partners, Pro Health International, have done this for 33 years across Africa. So earlier in the year, we partnered with them to do this type of outreach in Abuja. Even though some people will not accept that Abuja also has needs, right?
Of course, everybody has needs.
There's health.
Yes. So we have IDP camps in Abuja, right? 2 years ago, I was with them as well as our founder, Godman Akinlabi, in about 4 IDP camps, where we gave out free foods, free meals, free clothes. We also, as much as we could, did the medical outreach in that region as well, right? Because the needs are huge.
Very huge.
Yeah.
It's Nigeria that's making it.
Final question, so we can go.
Sustainability and growth. What strategies have you put in place to ensure that your programs continue to grow and thrive?
So in terms of strategies, one of the things that we have as a strength at Pistis Foundation is that we plan, right? So we planned the first 5 years. In December last year, we celebrated 5 years milestone. We gathered our partners in one place. We gave account of what we had done. And then we started the next 5 years in January, right? So we are on our next 5-year pipeline, right?
The pilot test
And skill model, right? In terms of sustainability, we see the need to put models in place as structures. I've talked about our endowment fund, for example, right? And that really helps to ensure that what we are driving, and let me simplify what an endowment fund simply is, right? You take a capital, some chunk of money, you put it in a capital investment portfolio that is safe.
Yeah.
And you take the return on investment of that,
Capital.
to run your projects, right? To run your programs. Of course, if there are well-meaning individuals there that can support what we're doing, they can also give towards that cause, because that was what Ford Foundation did, right? And when that grows, we're able to do more, right? And that is able to sustain the kind of programs that we do. So that's just one model in terms of sustainability strategy. Another strategy that we adopted, for example, on our educational program, is what you call Adopt a PF Scholar, initiative, where we allow individuals or institutions to adopt as much as 5 children, 10 children. When I say adoption, I'm not speaking to the regular context of adoption. I'm talking about where someone like myself and yourself can adopt 5 children in terms of their academics.
Oh, just pay their fees.
Yes,
and
what we do is just give you a timely report of that child. We
Oh,
just manage
that would be
that
amazing.
process. So we have a website for that. If you go to pistisfoundation.org, you can get to see more information about that. We have one institution that has, taking responsibility for 50 children.
Wow.
Right? And, across Lagos, Ogun, Oyo, and Delta states. Right? And we just give them the reports. We ensure that we're in touch with the parents of the children on a timely basis.
So you build trust because you give accounts.
Exactly. And we're transparent in what we do.
Thank you so much for coming to share with us. Is there any way people can reach out to you, your website, your handles, number? Do you have that? Can you call them out quickly as we are going?
So that's www.pistisfoundation.org is our website. For Ubomi, if you want to know more, you can just visit ubomi.pistisfoundation.org. You can also reach us on 07000 Pistis. 07000 Pistis. And we'll get in touch with you.
Thank you so much. Thank you for the work you're doing. God bless you, replenish you, increase you, bring more people to join your network so that we can help at a larger scale. Yes, that would be so amazing.
Thank you.
We've been speaking with the Executive Director of Pistis Foundation, Mr. Leonard Thomas. Thank you so much for being on the show. That's all we can take on this segment. When we come back, we move on to our topic for the day. Stay with us.
Stay tuned. Your View will be right back.